here I'm going to discuss few question and answer for Nclex exam. The first question here: a nurse is performing a autoscopic examination of a client with a ear pain. The nurse note that the tympanic membrane is bulging and red. Identify the structure that the nurse is assessment. So your patient complained of the ear pain. After examination of autoscopic examination, you found the tympanic membrane. This is inflamed, bulging, swelling, or tear, whatever it is. Examiner asking which anatomical area we call tympanic membrane. Right? This is the external ear. This is middle ear and internal ear. So you have to put the mark where the tympanic membrane. In this picture, tympanic membrane is here. What is separated the external ear canal to middle ear. So autoscopic examination. Otoscope, it is an instrument we use to look into the ear canal. This is the ear canal. And it is used to check the ear speculum, this one. Right? So this is the tympanic membrane, a cone shape viewing a piece of otoscopic view. Right? This is a normal anatomy. But here showing the tympanic membrane is ruptured, bulging, and edematous. So otoscopic examination is performed by pulling the auricle up and backward in case of adult. In children, auricle should be pulled downward and backward. And this process will move the acoustic meters in line with the canal. So I said, this is the area where tympanic membrane we can see. Rationale: the tympanic membrane separates the external canal and middle ear and may appear red and bulging in the client. If the client have a otitis media. What is otitis media? Inflammation of the ear, usually distinguished as a otitis externa or otitis media, means the middle ear inflamed, or otitis interna, when inflammation of the inner ear or labyrinth, like inflammation is here, we call otitis interna. If inflammation in this area, we call otitis media, because middle ear. If inflammation in that area, we call otitis externa, right? Pieces of the outer ear inflamed. Next question. Yeah, before go next question, here showing this is the adult man. We checking the otoscopic examination, right? And also in this picture, we can see pulling the auricle up and backwards. But if it is children, auricle should be pulled down and backward. This is the otoscope ear canal. And here few of the findings of otoscopic, normal findings. It is showing here wax, right? And also blood vessel is congested. Next question. Which assessment findings indicate assessment findings indicate the increase the risk of cancer, right? A deep sunburn, a dark mole on the client back, an irregular scar on the client abdomen, or number 4, white irregular patch on the client arms. So this examiner asking the question, the risk of skin cancer, right? The keyword is skin cancer. The skin cancer risk factors, basically. They said, which is the correct answer? Correct answer is a deep sunburn. In this table, we can see the skin cancer risk factors like family history, prolonged sun exposure, or patient give the history of sunburn. So the primary risk factor for melanoma or non-melanoma skin cancer is exposure to ultraviolet ray, what we called the exposure to the sunlight. So ultraviolet light exposure, including sunlight or including the tanning. So sunlight or tanning with the risks growing with the amount of exposure. What are the other causes? Maybe indoor tanning or certain type of mold, or the person who have blue or green eyes have a chance, red or blonde hair, right? So rationally, a deep sunburn is a risk factor for skin cancer. A dark mole or an irregular scar is a benign findings. White irregular patch are abnormal but are not the risk factor of the skin cancer. So next question here. A nurse is assessing an elderly client. When performing the assessment, the nurse should consider that one normal age-related changing. So what is the normal age-related changing? Number 1, cloudy vision, incontinence, diminished reflexes, and tremor. So keep in mind, what are the common age-related to everybody's? The most reliable age-related changing is the decrease, right? Decreased or diminish the reflexes, or we can say decrease the speed of processing. So how fast you do things and how fast you processing the information. So aging process, it is a subtitle effect, or people do not realize they are getting slower typically until the late life. So cloudy vision, maybe you have it, but others do not have it. It is not general. Everybody do not develop the cataract because of the aging. Every peoples will not develop the incontinence of urine or fecal materials eliminate. Everybody do not have it. Everybody do not have a tremor except dementia, Alzheimer, or Parkinson's disease. But everybody do not have dementia. Everybody do not have Parkinson's disease. Everybody do not have Alzheimer's disease. We do not talking number 3, absence the reflexes. We said diminished, decrease in the speed of process, how fast you do things or how fast you processes the information. So answer is the 3. The rational. Degenerative change can lead to decrease the reflexes, which are a normal result of aging. So this is the 2 pictures. Aging change in the nervous system. Healthy brain in adult person, young person. But this is the old age. Degenerative change occur. The brain tissue shrinkage. We see external shrinkage of cerebral cortex and cavity is getting bigger, right? Enlarge the ventricles. Degenerative change. But cloudy vision, incontinence, and tremor may be the sign and symptoms of underlying pathologies, meaning disease. Here a short note, what are the other common physiological change related to the aging, right? And definitely, what are the normal aging process, my friend? The aging process or normal aging, because of aging, our bladder capacity go down or increase the frequency in urine is a common also with the age, as the bladder muscle relax without warning due to the infection and damage to the nerves or other causes, bones, joint, muscle, cardiovascular system, eyesight, hearing, lungs, metabolism, sexual activities going down, right? Here showing some degenerative change in the nervous system, like patient develop dementia, particularly Alzheimer's disease or Parkinson's disease. In case of Alzheimer's, increase the double every 5 years of age up to 65. Current therapy limited or caregiver support effective. In case of Parkinson, often accompanied by treatable depression, often accompanied by dementia, or aggressive pharmacological treatment is effective. Another age-related problem occur in musculoskeletal system. This is the healthy vertebra, spinous process, and in between 2 vertebra, intervertebral discs. Degenerative disease or discs or narrowing the space in between the 2 vertebral body because of aging, erosion, right? Or degenerative disc problem, narrowing the root as well. Another problem occurred, it is we call macular degeneration. This is a normal, but here we can see blood clot, wet macular degeneration, and here showing dry macular degeneration. So macular degeneration, also physiological change related to the aging. What next? Next question. During the physical examination, a nurse used various techniques to assessment the structure, organ, and body system. Which technique allows the nurse to feel for vibration and look at the body structure? auscultation. Usually we use stethoscope for auscultation. Inspect, just observe, right? Palpation, we use your hand, right? And apply the vibration techniques. And last one is the percussion. So correct answer here, palpate. So in this picture, you can see, right? We palpate every quadrant in the abdomen. We palpate the deep structure. So palpation is two types, light and deep. So deep palpation of the abdomen, like this picture, is performed by placing the flat of the hand of the abdominal wall and applying firm, steady pressure. You see the picture? Your hand placing the flat of the hand of the abdomen wall, applying steady pressure. It may be helpful to use two-hand palpation, particularly in elevating a mass, right? So if any organ is getting bigger, you can feel it. If you see any kind of tumor mass, you can feel it. But the technique we use by vibrating process. So what are the explanation? During the palpation, a nurse touches the client body to feel for vibration and pulsations, to look at the body structure and to assess such characteristics as size, structure, temperature, tenderness, and mobility. During auscultation, the nurse uses a stethoscope to listen for the sound. During inspection, the nurse uses her critical observation scale, and during percussion, and she taps the client body sharply with her finger or hands to elicit the sound. Next question. A nurse measures a client temperature at 102 Fahrenheit. What are the equivalent centigrade or Celsius temperature? So when you measure body temperature, we found it is 102 Fahrenheit. How you convert to centigrade? After calculation, it would be 38.9 or 39, 40.1 or 47 Celsius. The correct answer is 38.9 Celsius. Whatever the technique to conversion, right? To convert Fahrenheit degree to centigrade or Celsius, use this formula. So if you want to convert a normal body temperature like 98.6 Fahrenheit, or examiner gave you 102 degree Fahrenheit to centigrade or Celsius, or plug the Fahrenheit temperature. So you see, this is examiner gave you Fahrenheit temperature. So we use this formula, Celsius temperature equal to Fahrenheit temperature minus 32. What are the result? You divided 1.8. After calculate or this mathematical easy equation, you can get 38.9. Imagine examiner gave you Celsius or centigrade temperature, you have to convert in Fahrenheit. As noted, to solving this type of calculation, you start using this formula. Celsius temperature over 5 equal to Fahrenheit temperature minus 32 divided or over 9. So examiner must give you any one, either Celsius or Fahrenheit. You have to count down to the another one. So it is very important how to convert Fahrenheit temperature to centigrade or centigrade temperature to Fahrenheit by using this formula. Next question, a nurse is assessing a post-operative client. Which information should the nurse document as a subjective data? So when you documenting data, we get subjective and objective data. Vital sign, laboratory test, client description of pain, and also electrocardiogram, EKG. So subjective data. Subjective data are the information from the client point of view. Symptoms, including feelings, perception, and concern obtaining through the interview. Whereas the objective data are observable and measurable data, sign, obtaining through the observation or obtaining through the physical examination, obtaining through the laboratory or diagnostic test. So correct answer is the client description of pain. So you do not measure the pain. It is the complaint of patient. Rational, subjective data comes directly from the client, are usually recorded as direct, that the reflect his opinion or feelings about a situation. Vital sign, laboratory test result or EKG are the example of objective data. Here we see a table about subjective and objective data. So you see the picture here, orange. So I have, taste are orange. I love orange. I ate orange and got the taste, right? So, and I love the orange. This is two different, similar, but they're a little bit different. So subjective data, like example, I have a fever, patient explain. When patient says I have a fever and you measure the body temperature and you found 100° Fahrenheit. So patient complain, fever, this is subjective data. Objective data, what you found after examination, like 100° Fahrenheit. Patient heartbeat 100 beats per minute, and it is dull. It's nature. Patient complain, I feel sick to my stomach. So you do not get in the stomach and you can see, not possible. What patient said, you have to trust. But you can see if patient has any kind of vomiting, but you do not see the nausea. Nausea is a desire of vomiting, but you can see the vomiting, something projectile come out. Like patient vomit 100 mg of the green color fluid. Patient has the abdomen is firm, slightly distended. Active bowel sound is there. So this is the measurable. Patient said, I have a shortness of breath. So you do not see the shortness of breath, but you, when you check the respiratory system, you get respiratory rate is 28 beats per minute. It is measurable, observable, objective data. Trachypnea, lung sound diminished, the lower low, you measure it. So objective data are observable, or objective data measurable, obtained through the observation, obtained through the physical examination, or laboratory or diagnostic testing. But subjective data, information from the client point of view, including feelings, perception, and concern obtained through your client interview. Next question. A nurse is helping a client ambulate for first time after 3 days of bed rest. Which observation by the nurse suggests that the client tolerated the activity without distress, right? So examiner asking the question about the ambulate the patient first time after 3 days of bed rest. What observation by the nurse suggests that the client tolerated the activity without distress? So ambulation is defined as moving a patient from one place to other place. So once a patient is assessment as safe to ambulate or determined if need assistance from additional healthcare provider or assistive device, we should find it out. My patient is able or not. So number one, the client took small steps at a rate of 40 to 50 per minute. Number two, say, the client reported feeling the dizzy and weak or perspirated profusely. Number two, the client reported feeling dizzy and weak and perspirated profusely. Number three, the client head was down, gaze was cast down, toes were pointed outward. Number four, the client pulse or respiratory rate increased moderately during the ambulation. Moderately, right? The correct answer is number four. The client pulse rate, respiratory rate increased moderately, not too much, during the ambulating. So rational pulse and respiratory rate normally increase during and for a short time after ambulation, particularly if it is the first ambulation after 3 days of bed rest, immobilization. A normal walking pace is 70 to 100 steps per minute. A much slow steps may indicate distress, dizziness, weakness, or profuse perspiration are defined sign of activity intolerance. A client who tolerated ambulation will hold his head erect, gaze straight ahead, or knee his toes pointed forwards. A client with ambulate with his head down or chest down and toes pointed outward, it is a sign of exhibiting activity intolerance, right? The next question here, vasodilatation or vasoconstriction produced by an external cause will interfere with a nurse accurate assessment of the client with a peripheral vascular disease. Therefore, the nurse should, number one, keep the client warm. Number two, maintain the room temperature at 78 degrees Fahrenheit. Number three, keep the client uncovered. Number four, watch the room temperature to the client's body temperature. So, examiner asking this question about the peripheral vascular disease. Peripheral vascular disease refer to the disease of the blood vessels like arteries or vein that is located outside the heart and brain. If it is affect the heart, we call cardiovascular disease. If it is attacked to the brain, we call cerebrovascular disease. But if it is outside heart or lungs, we call PVD, peripheral vascular disease, right? So the correct answer is here, keep the client warm. So here I'm going to talk about what is the risk factor of peripheral vascular disease. Let me read the rationale first. The nurse should keep the client covered and exposure only the portion of the body's client body that share the assessment. The nurse should also keep the client warm by maintaining his room temperature between 68 Fahrenheit to 74 Fahrenheit. In between, extreme temperature are not good for the client with peripheral vascular disease. The valves in their arteries and veins are already insufficient, and exposing them to vast change in the temperature could affect assessment findings. Keeping the client uncovered would cause him to become chilled. Matching the room temperature to the client body's temperature is inappropriate. So here showing the risk factor of peripheral vascular disease. So smoking, most important cause of this. And here showing when peripheral vascular disease because of arterial defect or peripheral vascular disease because of venous insufficiency, how you distinguish, compare, contrast. If the peripheral vascular disease because of arterial problem, we feel cool temperature, the skin, cold to touch. The skin should be thin, but here thick, dry, scaly, hairless or thick toenails. So peripheral vascular disease we also call PVD, refer to any disease or disorder of the circulatory system outside the brain and heart, right? So in case of venous, we can see the warm to touch, thick and brownish to color. Keep it note, peripheral vascular disease, the term can include any disorder that affect any blood vessel except heart and brain. It is always often used as a synonyms for peripheral vascular disease. What the next question? Next question here, when examine a client who has abdominal pain, the nurse should assess. So abdominal pain, patient have abdominal pain. So the nurse should assessment any quadrant first or symptomatic quadrant first or symptomatic quadrant last. Number 4, symptomatic quadrant either second or third. The correct answer is the symptomatic quadrant last. Imagine your patient have there are 4 quadrants, right? Left upper quadrant, left lower, right lower, and right upper. So if the patient complain the pain in the left lower quadrant, we will check this last. It is good to start from left upper quadrant, then right upper quadrant, right lower quadrant, then left lower quadrant. Right? So the symptomatic quadrant last. Rationale, the nurse should symptomatic assessment all area of the abdomen if time and the client condition permit, concluding with symptomatic area. Otherwise, the nurse may elicit the pain in the symptomatic area, causing the muscle in other area to tighten. The tightening would interfere the further assessment. Next question. A nurse preparing to perform a autoscopic examination on an adult. For the proper visualization, the nurse should position the client ear by pulling what position? Right? Autoscopic examination. What it is? A autoscopic examination means this is the picture you can see. Autoscopic examination. This is never exam patient while standing. Always sit down. And here showing auricle up and back in case of adult. So autoscopy examination is a procedure that examines the auditory canal and tympanic membrane for infection or any kind of blocking due to the presence of a foreign object or buildup of warts. So the tympanic membrane for the sign of rupture, puncture, or hearing loss, or canal for any blocking, we can find it out by autoscopic examination. So they said to perform autoscopic examination on an adult, the examiner pull up the auricle, pull up and back to straight the ear canal. For a child, the nurse auricle and pull So in case of the child, the healthcare provider pull the auricle it down and straight to the ear canal. Next question here. So a question here, a nurse is assessment tractal fremitus in a client with a pneumonia. So what is tractal fremitus? So tractal fremitus a type of the vocal fremitus we found over the area of secretion or tussive fremitus on felt of the chest while patient had coughing, right? So next question here say, for examine, the nurse should use fingertip. Number 2, ulnar surface of the hand. Number 3, dorsal surface of the hand. And number 4, finger pad. So the correct answer is ulnar surface of the hand. So in this picture, we can use, you see this one, we use the ulnar surface of the hand. So rationale, the nurse uses the ulnar surface or bell of her hand to assessment the tractile fremitus. Okay. Or thrill, vocal vibration through the chest wall. The fingertip or finger pad best to distinguish texture and shape. The dorsal surface is the most sensitive for temperature. Here showing tractile fremitus. Tractile fremitus means vibration of the chest wall, result of sound transmitted through the lung tissues. So tractile fremitus is increased transmission of the sound wave through the consolidation of lungs. So you see that what are the causes when tractile fremitus reduce? If excess air in the lungs, like pneumothorax, if increase the thickness of the chest wall. So what are the causes increase the fremitus, like lung consolidation? So tractile fremitus is the increase the transmission of the sound wave when through a consolidation, like tumor. Assessment, what we assessment? Examine, feel for change in intensity of fremitus by palpating the wall. Next question. When determining appropriate nursing intervention for a client with a medical diagnosis, the nurse uses developmental anatomy, applied anatomy, regional anatomy, or descriptive anatomy. So what is medical diagnosis? Medical diagnosis is the process of determining which disease or condition explain a person's symptoms and sign. It is the most often referred to an diagnosis with the medical